La salud de nuestra comunidad con el Dr. Tallaj es presentado por cortesía de HealthFirst. Para encontrar maneras sencillas de hacer elecciones más saludables, visite el sitio web healthfirsthealthyliving.com.
Señores, qué bueno ahora en esta mañanita con este frito de diciembre nos sentimos muy bien. En el caso del día de hoy tenemos con nosotros a alguien muy importante, el señor George Halls, que es el vicepresidente de External Affairs de HealthFirst, un seguro de nuestra comunidad de salud, que le decimos su salud primero, que es grandemente trabajado con nuestra comunidad. Nosotros somos prácticamente el número uno en la ciudad en servicios. Y George, que está con nosotros, quisiera darte las gracias por estar con nosotros y hablar un poco. I want to say in English, my first question, George, about you is that, how does HealthFirst is supporting the Hispanic community in New York?
Well, Dr. Tallaj, let me first start by saying thank you so much for the opportunity of being here with you, one of HealthFirst's greatest partners. And let me also say that a part of our partnership is because many people don't realize HealthFirst is a not-for-profit managed care plan. We're a not-for-profit HMO. And so we are not in the money business, we are in the healthcare business. And that's why our partnership is so important, because we're a not-for-profit managed care plan that's owned by hospitals. We're the largest HMO in the country that is owned by hospitals, and many of those hospitals are associated with you and your organization. And I'd like to say, before I say anything else, that we would not have the great success with our members' health at HealthFirst without our relationship with you. The cornerstone of HealthFirst is our community hospitals. We're owned by St. Luke's Roosevelt, we're owned by Montefiore, we're owned by Beth Israel, we're owned by Bronx Lebanon, we're owned by Lincoln Hospital and Harlem Hospital, and all the community and private hospitals almost in the entire city. And as a result of that relationship, being owned by the hospitals and having a relationship with provider organizations like Corinthian and Celsius has really made the difference for us.
And I tell you, George, to interrupt you there, esa es una realidad. Él acaba de decirnos la gran relación que existe entre nosotros, los médicos de la comunidad y HealthFirst. Close to 800,000 of our patients in poor community. I'm not talking about big, rich community. Talking about the community with more difficult to treat, the Hispanic community in all the areas of Washington Heights, Bronx, Queens, Brooklyn.
Yeah, 1 out of every 8 members in HealthFirst comes from 2 organizations that are primarily, almost exclusively Latino and primarily Dominican, Corinthian and Celsius. And it's really a credit to you and Dr. Villegas and the people who work with you and you partner with that we've had such great success. You know, our aim at HealthFirst, our primary mission is access to health care. We want to make sure everyone has access to health care, and very often immigrants don't understand how public health insurance works in New York City, and that's the advantage of having a relationship like we have with you. And then we want to keep our members healthy, and so we talk about preventive health. You know, we know people are going to become diabetics. Yeah. We know people are going to have heart disease, but we want to put that off. 1 out of 3 people in the Bronx is either a diabetic or going to become a diabetic. We would like to change that. And working with our community providers like you, HealthFirst, we feel we can change that because the community trusts you. Something else that we're very concerned about is, of course, is good care. And we want to offer the best care, and we do that as a result of our provider relationships with people like the people who are part of your organization. And the 4th thing that we're concerned about with good health care that we never talk about, it's not clinical. It's being active in the community, doing things that embrace the community and empower the community, such things as economic development, working with the community on educational missions, some of the things we do together for educational literacy, helping the Dominican and Latino community become better students. Because we know if people become better students, they're going to change their lifestyle. They're going to change their diet. They're going to exercise more. They're going to have better jobs. There's going to be less domestic violence. It's going to be a more positive community. Many of the things that you encourage us to do, we do them because they make sense. And our involvement in the community, a part of the reason why we have grown so much is because the community understands our concern for them. We know that healthcare is more than just clinical things. It's also involvement. And let me say something else that I want to congratulate you on right now. I want to congratulate you on the mission that we do every March with the Friends of Lead-Free Children going to the Dominican Republic.
You know what, George? I want to hold that there. Déjenme decirle a usted en español. Las cosas que yo le acabo de decir son tan importantes como una relación de un HMO llamado HealthFirst, su salud primero, es tan importante en nuestra comunidad, en la prevención, en el tratamiento, en los medicamentos, en todo. Es real. Por eso que muchas veces cuando oímos hablando en noticias y cosas acerca del servicio que se da a los HMO, no podemos incluirlos a todos. HealthFirst es diferente. Todo lo que nosotros necesitamos para nuestros pacientes, en la prevención, en el tratamiento, se consigue en HealthFirst. Y sobre todo los hospitales con los que trabajamos de una manera mancomunada. Vienen grandes cambios en la ciudad y en el estado de cómo se manejan los pacientes. El número 1, HealthFirst, ya está trabajando con nosotros para acomodarnos, para que esos cambios sean de provecho para todos nuestros pacientes. Y ahí es que yo quiero felicitar a HealthFirst en su persona de George Halls y su presidenta Pat Wan en las cosas que hace trabajando juntos. No es un plan que dice esto es lo que hay que hacer. Se reúnen con nosotros y como grupo decidimos los cambios que hay que hacer. Antes de seguir hacia adelante, voy a pedir para que hagamos unos comerciales muy interesantes para todos ustedes. Muchas gracias.
La salud de nuestra comunidad con el Dr. Tallaj fue presentado por cortesía de HealthFirst. Para encontrar maneras sencillas de hacer elecciones más saludables, visite el sitio web HealthFirstHealthyLiving.com.